Hello, I am Dr. Giorgianna Passerello. Today I will be presenting a project I recently completed at NHS Lothian, Scotland, focusing on designing a prehabilitation form for our electronic patient record (EPR) system. Prehabilitation enhances various patient factors such as exercise, nutrition, emotional well-being, lifestyle choices, and medical optimization prior to surgical or non-surgical cancer treatments. Initial evidence suggests that this approach can lead to improved outcomes and recovery. In NHS Lothian, each prehabilitation appointment is recorded as a separate entry in their EPR, complicating the tracking of progress. Our goal was to simplify the documentation of the patient's prehab journey by creating a centralized EPR form. This form, associated with the patient's treatment episode, will be updated at every appointment and aims to improve continuity, support regular audits, and enable better outcome evaluation. In May 2024, in collaboration with the NHS Lothian eHealth team and leads from the anaesthetic and prehab services, we established the project's goals, scope, and potential challenges. We selected the components to include in the EPR form, which features embedded links to patient resources. By September 2024, we developed a pilot version that was tested by 3 members of the prehabilitation team. In October 2024, we collected feedback on the pilot form. Team members reported that it was user-friendly and the prompts were clear. However, we identified some broken hyperlinks and a few spelling errors. To ensure that relevant structured data could be easily extracted for service evaluation, we consulted a data analyst. With this input and the feedback received, we refined the final form. Additionally, a user guide was created and distributed to facilitate adoption when the final version was rolled out across the service in February 2025. Here are some screenshots of the final form showing what sort of information was included. This project demonstrates how collaborative digital solutions can improve clinical documentation and data quality. However, the form's scope and features were limited by the resources provided by the eHealth team. Although the timeline progressed slower than we had originally anticipated, we remained committed to achieving a successful final project. Despite these challenges, we worked together effectively to create a form that enhanced data quality. Moving forward, our future efforts will focus on auditing the form's usage and leveraging the gathered data for service evaluation.